is Sunday, October 7th, and this is Journal 6. So this journal is me kind of speaking to clinical, or I guess our clinical class. Could see where that could be confusing. So kind of getting into like if our classroom really feeds into the real experience, and what's different. So, in my opinion, what we learn in the classroom really is like pretty much in all aspects equal to what you experience, because what we're learning is like very real, and it's patient care and like having to identify like this is what this will present as, and you just have to like, oh, that's this, or they're having these symptoms, that's this, or um you know, but I do think that there is a difference that I think that I've experienced. The realness of the patient contact or the patient relationship is because there's really no way that you can simulate that. Like the patient feels what they feel, or they think that they feel what they're feeling, and you kind of have to differentiate, which is like a differential diagnosis, yes, but like especially this semester being off site, I have encountered like, going out on the field, and you can't really control like how they're acting, I guess, because of their pain tolerance, or like I would say like when someone gets hurt initially, when you are there initially doing it on the field, they're not getting up, stuff like that. I think their mind, well, yes, when I get hurt, my mind takes over, like, oh, it's this, and it's like overriding what it actually is, and it kind of hypes you up, and start increasing your respirations, your heart rate is going, your heart is going, because you were like, this could be something really serious. There's no really way to simulate that in our classroom, because it's just how it is. It's real. That's why you call it clinical experience, in my opinion. I also think that, like, because of how we learn in class, in any of our athletic training classes, we are learning, like, the cookie cutter, this is what it is, this is how they feel, this is where, swelling will be, they won't be able to do this, which, like, sometimes, yes. But then you think about it, and, like, when you go out and actually experience it, then it's like, it could be this, but I don't know if it is, because they don't have this part. And that's the part that holds me back. So then you get into the point of prioritizing, like, okay, well, if they have this, and it's like a really big deal, like, do you say this, but they also have this? And yes, you can have multiple things going on at once, but it's just, I think the biggest difference that I have actually encountered is just the realness. Just like, patient goes down on the field, not getting not moving, referees call you out, you're going, and they're screaming and rolling, and you're trying to rule out like a head injury, make sure they're not bleeding, like any gross deformity, like rule out C-spine before they're moving, and it's a lot. It's just like I kind of have like a tunnel vision kind of thing where I just don't hear anything, and then all of a sudden you just like, the silence breaks, I guess. Every time that it's happened to me, it's kind of like this is my priority. I'm not worried about anything else, and I cut everything out, which like could be really bad, but I think that is like the one true thing that I've encountered that's different is like the realness of going out, and you're kind of like their lifeline at that point, like regardless of if it's something serious or not. What if it's like their first ankle sprain and everyone says it always hurts the worst? Maybe that's a mental thing because they're scared or something else. Like, it's just everything is different with every person. So that's why, like, some people swell a lot, some people don't. So, like, someone could have a knee injury, and you're like, well, they have a lot of swelling like this, so I'm gonna think that it's ACL, and they can't walk. And then you send them for imaging, and they're like, nothing's wrong with you. It just looks like you have a bruise. And then you're like, okay, well, that's one that I missed. It's just, I guess the realness of like your hands and what you remember is like really all you got. But besides like that, I think that honestly almost everything that we have learned in the classroom setting like really does closely correlate to, or really does like closely compare to what we do outside of the classroom. I guess it's not as scary when you're sitting in the classroom and you're, taking notes, or you're behind a laptop just like, oh, typing this, gotta remember it, and like, then, it's not as scary to be in the classroom setting as it is to be on the sideline, just kind of like a waiting game. Like, is something gonna happen today? Or is something bad gonna happen? And stuff like that. Like, I've had that talk with a preceptor, just like, you get to the point where you think that a team has bad luck. And then you're like, well, it might just be how they have their program, and it's like, it's just bound to happen at that point. Or, like a right time, right place injury. It's just like, that's how it happens. Like, you can't do anything about it. I would say that nothing else has really been different. I feel like the way we learn how to eval, and okay, we've had lots of different, not lots, we've had a handful of classes, and they all talk about, how you go through your evaluation. And, you're going in their order. So I guess I have experienced that. Like, I go in a different order because when you are on the field in the middle of the game and like the ref is like, can we move him? Like, you're not gonna be like, oh, is this, do you have like stuff like that? Like, you hit the major points, and if they can move, you move, and then you get into it. We're not like, all right, well, I can't do that. I gotta start from the beginning, and then you're out there doing like range of motion on the field. Like, that doesn't happen, And regardless of like, yeah, your on-site evaluation and stuff like that, like, sometimes you need more to really justify what's going on, and kind of, because if it is something that like you're like, I don't feel comfortable moving him, or I don't have enough help, or I need to stabilize, or something like that, then you're the one that makes the call. Like, if you are the only, I guess, trained professional in that situation, like, you need more information, because if you say, well, yeah, that's fine, just pick him up, and like, you didn't rule something out, or something else starts to happen, or they fall unconscious because of pain or something, they see something and pass out, like a deformity, and then you're like, I shouldn't have moved them because now they're unstable. And then you're like trying to get into more serious things when you're like, this could be this or something like that. I think also a big thing is like, we talk about coaches and team personnel and being on your team, I have encountered different. Before my offsite this semester, I have encountered it some, but really this semester being in a high school where sometimes I don't have someone there that is a certified, they're not really, they get to the point where they're like, oh, they're fine, just get up. And then you're like, something could really be going on, like, and then they're like, well, I do this all the time when you're not here, and then what are you supposed to say? Like when you're doing your on-site really quickly, trying to figure out if you can move someone or not, and then here comes a coach across the field, and it's just like, well, if you can see me and see my fingers and you move your hands and your feet, you're getting up. Like, not even caring about anything else. Like, well, you're getting up because all we care about is the game. So, I do think that, sometimes they are on our side, and especially like in a setting where you have an athletic trainer there with you, practice, game, like stuff like that, then I say yes, definitely. But some places you go where they don't have access to have an athletic trainer 24/7, like we do here at the college, like they learn their own skills, I guess, and to try to compensate for care and stuff like that. But they don't really consider you on the team, on that team. You're not a part of the care team because you're not there. So that's very different, and that was very hard for me to be like, this is weird, like why is this happening? But you're just kind of like, well, just kind of hope if they yank them off the field and stuff like that, then you just make your way over there and keep doing it. And if something happens, then you're like, well, that's on them. But it's just awful. I don't know. I was very uncomfortable. But I really do think that our classroom really does put us into a place where we're really prepared for what's about to happen, or we're really like prepared to be like, this is happening, like this is what I need to do. So we kind of train our brains that way, and there's not that many differences I've encountered, but yeah. So this is a long one, but I like school, so. But yeah, that's my 6th journal.